Most people who care about healthy aging believe doctors see older patients with nothing but respect. After all, you've lived through wars, economic changes, and family challenges, and you carry wisdom that only life after 60 can provide. But here's the uncomfortable truth. Many physicians hold quiet assumptions about seniors they'd never dare say aloud. These thoughts may shape how they treat you, or fail to treat you. And in the world of seniors' health, silence can be dangerous. Picture yourself sitting in the exam room. The doctor walks in, smiles politely, and asks a few questions. On the surface, everything feels normal. But behind that professional mask, their mind is running quick judgments. Is this pain serious or just old age? Should I explain the risks? Will they even understand? These unspoken thoughts create invisible barriers between doctors and seniors, and those barriers can determine whether you get the care you truly need. The healthcare system wasn't built with seniors at the center. It's designed for speed and averages. But aging well isn't about averages. It's about the unique story written in your body, your habits, and your history. Doctors under pressure sometimes see those details as too much and reduce everything to age. That shortcut might save them time, but for you, it could mean misdiagnoses or the wrong treatment. Think about your own experiences. Maybe you left an appointment where your back pain was brushed off with, "That's normal at your age." Or maybe you walked out with yet another prescription without really understanding why. Those moments leave seniors feeling dismissed. And if you care about seniors' health and healthy aging, you know deep down this isn't just frustrating, it's risky. That's why today we need to pull back the curtain. We're not going to settle for polite smiles or vague reassurances. We're going to dig into what doctors and seniors don't say to each other, the silent truths shaping care in America. Some of these truths may sting. Others may shock you. But every one of them matters if you want to keep aging well and living fully. So let's be clear. This is not about fear. It's about empowerment. By knowing what many doctors really think about life after 60, you gain tools to speak up, ask better questions, and protect your independence. I'm about to reveal 5 ugly truths every senior needs to hear. The first one is especially painful. The way doctors often dismiss your pain as just aging. One of the ugliest truths in healthcare is how often doctors wave off real pain as nothing more than a normal part of life after 60. Imagine telling your doctor about sharp knee pain that keeps you awake at night, only to hear, "Well, that's what happens as you get older." This response is more common than most people realize, and it can delay real solutions. For healthy aging, dismissing symptoms isn't just lazy medicine. It's dangerous. Here's the problem. Not every ache is just aging. Sometimes it's arthritis that can be treated, or a heart condition that needs immediate attention. But when doctors and seniors fall into this routine of minimizing pain, serious issues slip through the cracks. If you've ever left a clinic thinking, "Maybe I'm just complaining too much," know this. It's not weakness. It's the system conditioning you to accept less than you deserve. Another practical step is seeking a second opinion. Many seniors hesitate, worried they'll look ungrateful or distrusting. But think of it this way. Would you trust only one mechanic with your car if it kept breaking down? Of course not. And when it comes to seniors' health, your body is worth far more than any car. Second opinions often uncover solutions your first doctor overlooked or dismissed. Paragraph 06. The bottom line is simple. Pain is never just old age. It's a signal, and signals deserve respect. If you want to keep aging well and thriving in life after 60, you need to treat every symptom as worthy of attention. And once you start challenging those lazy medical assumptions, you'll discover the second ugly truth doctors rarely admit: how deeply they underestimate seniors' ability to understand complex information. I once spoke with a woman in her 70s who had severe stomach pains. Her doctor brushed it off as normal digestion at your age. Months later, she discovered it was gallstones requiring surgery. Had she trusted that first dismissal, she could have faced life-threatening complications. Stories like this highlight why seniors' health needs stronger advocacy, because aging well doesn't mean ignoring pain, it means investigating it. So, what can you do when a doctor shrugs at your symptoms? First, write down exactly what you feel: time of day, intensity, what makes it better or worse. Second, don't accept vague answers. Ask directly, if I were 30, would you still say this is normal? That simple question shifts perspective and forces the physician to confront their assumptions. This isn't being difficult. It's protecting your healthy aging. Another practical step is seeking a second opinion. Many seniors hesitate, worried they'll look ungrateful or distrusting. But think of it this way. Would you trust only one mechanic with your car if it kept breaking down? Of course not. And when it comes to seniors' health, your body is worth far more than any car. Second opinions often uncover solutions your first doctor overlooked or dismissed. The bottom line is simple. Pain is never just old age. It's a signal, and signals deserve respect. If you want to keep aging well and thriving in life after 60, you need to treat every symptom as worthy of attention. And once you start challenging those lazy medical assumptions, you'll discover the second ugly truth doctors rarely admit: how deeply they underestimate seniors' ability to understand complex information. Another harsh truth in healthcare is that many doctors assume seniors can't follow complex medical information. In the world of seniors' health, that assumption can be devastating. Imagine sitting in the exam room while the doctor rushes through terms like hypertension or neuropathy, then quickly changes the subject, thinking it's too much for you. This mindset isn't just patronizing. It robs older adults of the chance to actively participate in their own healthy aging. I've heard countless stories of seniors leaving appointments confused with prescriptions they don't fully understand. That confusion often leads to missed doses, incorrect usage, or unnecessary fear. The irony? Many of these same people managed businesses, raised families, and solved problems far more complex than a medication schedule. The idea that life after 60 makes you less capable is not only insulting, it's false. Doctors sometimes forget that clear explanations are not a favor, they're a responsibility. Doctors and seniors should be partners in decision-making, not locked in a one-sided lecture. If you don't understand why you're taking a pill or why a test is necessary, your chances of following through drop significantly. And if the goal is aging well, then true understanding isn't optional. It's essential. One practical way to break this barrier is by asking your doctor to teach back. Say, "Could you explain it to me as if you were teaching it to a friend?" This doesn't make you look less intelligent. It forces clarity. Another powerful tool? Bring a notebook. Write down terms, ask for spellings, and request printed summaries. These small actions not only protect seniors' health, but also signal that you expect full transparency. Let's be honest. This isn't just about information. It's about respect. When a doctor assumes you can't grasp something, they're quietly stripping away your independence. But life after 60 doesn't erase a lifetime of learning, memory, and critical thinking. In fact, many studies show older adults can process medical information just as effectively as younger patients when it's delivered clearly. Healthy aging thrives on knowledge, not on being shielded from it. So the next time you sense a doctor skipping details or brushing off your questions, stop them. Remind them you deserve to know everything about your body and your choices. That shift transforms you from a passive patient into an active partner. And once you claim that power, you'll be ready to uncover the third ugly truth: how often doctors assume seniors don't want aggressive treatment or bold solutions. Here's another ugly truth many don't realize. Some doctors quietly assume seniors prefer comfort over aggressive treatment. In their minds, life after 60 is about slowing down, not fighting back. But that assumption can strip away your right to choose. For seniors' health, this mindset often means fewer tests, less follow-up, and limited treatment options, all because the doctor decided for you what your priorities should be. I once spoke with a man in his late 60s who had shortness of breath. His doctor dismissed advanced tests, saying, "At your age, you probably don't want invasive procedures." Later, another physician ran the tests and discovered a heart blockage that could have been fatal. This shows how dangerous it is when doctors and seniors don't share the same expectations. The doctor thought he was protecting him, but in reality, he was putting his life at risk. Of course, not every senior wants aggressive treatment, and that's perfectly fine. But the choice should always be yours. Healthy aging means keeping control over your healthcare decisions, whether that's choosing physical therapy instead of surgery or saying yes to an advanced procedure if it gives you more years of independence. Doctors are supposed to present the options, not edit them down based on assumptions. Here's a practical tip. When discussing treatments, ask directly, "What would you recommend if I were 40?" This question forces the physician to reveal whether they're lowering expectations because of age. Another strategy is to bring a trusted friend or family member into appointments, someone who can help ensure all the options are laid out. These steps help safeguard seniors' health and prevent silent decisions being made on your behalf. Think about it this way. Aging well isn't just about living longer, it's about living stronger. Maybe that means pursuing a treatment that gives you energy to travel, play with grandkids, or keep gardening. Or maybe it means choosing comfort in certain situations. The point is, life after 60 is still your life. Doctors should never decide the value of your future based on your birth certificate. When doctors assume seniors don't want bold solutions, they limit possibilities before the conversation even begins. But once you learn to spot this bias, you can take back control of your narrative. Because the truth is, many doctors also carry another hidden belief, that seniors don't really care about lifestyle changes. And that misconception leads straight into the fourth ugly truth. Here's a painful stereotype many physicians carry. They assume seniors won't change habits, no matter what advice is given. In the world of seniors' health, this belief often leads to fewer lifestyle recommendations and more prescriptions. Instead of discussing diet, exercise, or stress management, they jump straight to pills. But healthy aging thrives not on quick fixes, but on sustainable changes. And seniors are more than capable of making them. I remember a doctor once told a patient in her 70s, "You probably won't start exercising now, so let's just manage your cholesterol with medication." That woman later joined a walking group, lost 20 pounds, and lowered her cholesterol naturally. This is proof that life after 60 is not the end of transformation. It can be the beginning of a whole new chapter. Doctors and seniors need to break this myth together. The truth is, seniors often have more discipline than younger generations. Think about it. You grew up in a time when perseverance wasn't optional. It was survival. Applying that same grit to aging well is powerful. Whether it's cutting down on sugar, walking daily, or practicing mindfulness, older adults are perfectly capable of building healthier routines. And each small shift protects long-term seniors' health. Practical tip: choose just one area to focus on first. For example, swap soda for water, or commit to 10 minutes of stretching every morning. These changes may sound small, but they stack up quickly. And when your doctor sees results, it challenges their assumptions. Suddenly, the conversation shifts from "you won't change" to "what's the next step?" That's how healthy aging is built, layer by layer, choice by choice. Let's not forget, lifestyle changes don't just impact your body, they impact your mind and spirit. A senior who joins a Tai Chi class isn't just exercising, they're connecting socially and sharpening balance. Someone who chooses healthier meals isn't just lowering blood pressure, they're boosting energy for travel or hobbies. This is life after 60 at its best, reclaiming vitality and proving stereotypes wrong. So the next time a doctor shrugs and assumes you won't follow advice, surprise them. Show them that aging well is about resilience and growth. Each change you make chips away at the bias that seniors are set in their ways. And once you prove them wrong on lifestyle, you'll see how it ties directly to the fifth ugly truth. Many doctors quietly underestimate your emotional resilience. The final ugly truth might be the most damaging. Many doctors assume seniors are fragile not only physically, but emotionally. They tiptoe around conversations, thinking you can't handle tough news. But anyone who's lived life after 60 knows resilience is practically woven into your DNA. Healthy aging isn't about avoiding reality. It's about facing it head-on, with the strength built from decades of challenges. This underestimation often means doctors soften their words or withhold full details. While their intention may be kindness, the result is disempowerment. In seniors' health, knowledge is power. When crucial information is hidden, you lose the ability to make clear decisions for yourself. And doctors and seniors need honesty, not sugarcoating, if the goal is truly aging well. Think back to what you've survived: personal losses, financial setbacks, global crises. Compared to that, hearing a doctor explain a diagnosis clearly isn't going to break you, it equips you. A woman I knew in her late 60s was told gently, "Don't worry about the details, just trust the treatment." She pushed back, demanded clarity, and learned she had real choices. That courage reshaped her entire journey of healthy aging. Here's a strategy. When you sense a doctor avoiding full truth, ask directly, "What aren't you telling me?" This question cuts through hesitation and reminds them that seniors aren't children to be protected, but adults capable of handling reality. Being open to difficult news actually strengthens seniors' health because it allows proactive steps instead of last-minute reactions. And let's not forget, emotional resilience is one of the greatest assets in life after 60. Research shows seniors often handle stress better than younger adults, thanks to perspective and lived experience. Doctors who underestimate that resilience rob you of your dignity, but when they acknowledge it, the partnership becomes stronger, empowering you to keep aging well with confidence. So the next time a doctor looks at you with pity, remember, you've walked through storms they can't even imagine. You don't need sugarcoating, you need truth. Because in the end, emotional resilience is the foundation of healthy aging. And now that you've uncovered all 5 ugly truths, it's time to talk about what comes next. How you can use this knowledge to take control, protect yourself, and thrive no matter what. You've now seen the 5 ugly truths most people never hear. From doctors dismissing pain as just old age to underestimating emotional resilience, these patterns are real, and they affect seniors' health every single day. But here's the empowering part. Awareness gives you leverage. Once you recognize these hidden biases, you can push back, ask better questions, and demand the respect every person in life after 60 deserves. Remember, healthy aging isn't just about avoiding illness. It's about actively shaping your health journey. That means refusing to accept vague answers, requesting second opinions, and embracing lifestyle changes that doctors may assume you won't make. Each step you take chips away at stereotypes and proves that doctors and seniors can build stronger, more honest partnerships when both sides come to the table equally. Think of your life as a book. Every chapter after 60 isn't a slow ending. It's a brand new story, filled with chances to grow, explore, and thrive. Aging well means seeing yourself not as a burden, but as a force of wisdom, resilience, and possibility. And when you carry that mindset into the doctor's office, you remind the medical system that seniors are not to be dismissed, they're to be heard. But knowledge only becomes power when you act on it. So ask yourself, are you ready to challenge lazy assumptions? Are you prepared to demand answers, to change habits, to claim ownership of your own body and future? Because if you are, then healthy aging stops being a hope and becomes a daily reality. Life after 60 can be vibrant, joyful, and powerful if you choose it.
Here's the challenge. At your next appointment, don't just listen, engage. Take notes, ask questions, push back when necessary. Show your doctor that you are not defined by age, but by determination. This is the essence of seniors' health: independence, courage, and choice. And once you step into that role, every visit becomes less about surviving and more about aging well with strength. Now, before you go, I have one more request. If this message spoke to you, if you felt seen, understood, and empowered, hit that like button and subscribe to the channel. Turn on notifications so you never miss a new video, because we'll keep diving into the truths that matter most for doctors and seniors: healthy aging and living your best life after 60. You deserve nothing less.